So you've been diagnosed with prostate cancer. Whether you decide to pursue treatment with surgery or radiation, the recovery is a journey, and it starts the minute of your diagnosis. So today, my name's Maya Van Dyke. I'm a urologist at UT Southwestern in Dallas, Texas, and we're going to talk a little bit about what that recovery looks like, both after surgery and radiation, and what you can expect and what may be in store for you. Just as a reminder, when we do these presentations, we do ask you to keep your audio and video recording completely turned off. Just as a reminder, when we do these presentations, we do ask you not to do any sort of audio or video recording, just so that people feel free to view the information in its entirety and make sure that we keep people's privacy intact. So as you may know, prostate cancer is the most common non-skin cancer in America and affects 1 in 9 men. And what does that mean? That means that today, nearly 3 million men in the United States count themselves as prostate cancer survivor. Now, prostate cancer treatment takes many forms. It can include surgery, radiation. You may hear things like proton beam therapy or focal therapy being thrown around these days. But regardless of the treatment modality, there are side effects involved in treatment, and these can include commonly things like bladder leakage and erectile dysfunction. So that's what we're going to talk about today. First, we're going to talk about urine leakage and methods to help you restore your continence. So what can you expect? Well, as I said, your journey starts the minute you have prostate cancer treatment, whether that's surgery, radiation, or even something else. And after that treatment, you may experience incontinence, anywhere from a few drops per day to even uncontrolled leakage of urine. Now, for many patients, even most patients, this leakage tapers off within several weeks to months, especially after prostate cancer surgery called a radical prostatectomy. And most patients regain bladder control within about a year after surgery. However, anywhere from 10 to 15% of men may have persistent stress urinary incontinence after surgery for prostate cancer, and this can really affect your quality of life. So how often does this occur? Well, this has been studied, and the real answer is somewhere between about 10 to 15% of men still have persistent stress urinary incontinence, even 1 year following robotic radical prostatectomy. That's surgery to remove the prostate for prostate cancer. Now, it's important to know that if you're bothered by this leakage, you do have options. You do not have to live with this day in, day out. And that's where providers like me come in. So how do we treat this? Well, we can start with the easy things that are non-invasive and low risk. These include things like using absorbent pads or diapers during the day. Some men with more serious leakage even layer those pads inside their diapers or inside Depends. Some men choose to use external catheters, sometimes called condom catheters, that go on the outside of the penis to collect the urine. Penile clamps are often used as an option. They actually close down on the urethra to keep it squeezed shut during the day when you're active and can really help decrease the amount of urine leakage. You'll also hear your surgeons and your urologists talk about things like pelvic floor physical therapy. So the thing that gives you continence is actually the muscles of the pelvic floor, both the sphincter muscle, which we will talk about soon, and then a whole host of muscles that surround it, almost like a hammock for the bladder. And physical therapy can help to strengthen those muscles and help you really restore that continence. For people who have more severe bladder leakage, or people who aren't interested in using things like pads and clamps and catheters, we can talk about surgery. You will see and you may read about options like injections or bulking agents. These are not used a lot, but if it's something that you're interested in, you can certainly talk to your urologist about that option. For men who have more mild to moderate bladder leakage, certainly the male sling is a very good option. This is a day surgery. It's done in about 60 to 90 minutes. And in most cases, you go home the same day of the procedure. And what this does is this puts a strip of mesh that sits under the urethra to act as a hammock, as a backboard, to help support the urethra when you do things like coughing, laughing, straining, even doing the things that you like to do, like golfing or picking up your grandkids. So having this strip of mesh there can really provide a little more support for the urethra and decrease the chances of you having urine leakage. One of the benefits of this procedure is that most patients can be continent immediately following the procedure. Now, your surgeon may choose to leave a catheter in place for a few days or up to a week, but once that catheter comes out, most men see an immediate improvement in their leakage and their quality of life. For men who have more severe bladder leakage, or perhaps men for whom the sling did not restore continence the way that they desired, another option is the artificial urinary sphincter. This is a little bit more complex of an option, but is what we call the gold standard. It's a device that's been around now for 50 years. So 50 years of research and development has gone into making it what it is today. What does it consist of? Well, as you see here on the screen right, there are three main components. There's a cuff that sits around the urethra. It's an inflatable cuff, almost like an inner tube, and it keeps the urethra squeezed shut. It takes the spot of that normal urinary sphincter in order to keep the urethra shut when you are going around your daily life. There's also a pump that sits down in the scrotum right next to the testicles, but not exactly in the same area. And lastly, there's a small balloon called a pressure regulating balloon that sits up in the abdomen. That stores the fluid for the device. So what happens is that this device spends most of its time in the closed position, keeping that urethra nice and tight. And when it's time for you to urinate, you feel it just like normal. But instead of just going ahead and urinating, you reach down into the scrotum, you feel that pump, which is underneath the skin, and you're going to pump it 2 to 3 times. That moves the fluid out of that cuff and opens it up. And that opening allows the urine to flow down from the bladder through the urethra and out into the toilet. Now, the nice thing about this is that you don't have to do anything at all to close it. It actually automatically closes on its own over about 90 seconds to 2 minutes, allowing you time to get all of the urine out of your bladder. Now, as you may have guessed, this is entirely internal. There are no parts of this that are outside the body, okay, which is nice. So no one walking down the street is going to know that you have this device, but it can make a really big difference in your level of leakage and in your quality of life. So how do you know which of these options is right for you? Well, the most important thing is to first and foremost talk to your urologist. Please, please be open with him or her about the symptoms that you are experiencing. We want to know if most of your leakage is with things like coughing, laughing, straining, or if it's more urgency. You know, you're sitting there, you feel that urge to urinate, and all of a sudden the urine just comes spurting out. We want to know that so that we can help counsel you for the best option. We also want to know how many pads per day or diapers you're going through. And your urologist may do some extra testing in the office, something like a cystoscopy, where they look inside your urethra and your bladder with a camera in order to assess what surgery or treatment might be the best fit for you. You can also go to this website listed here, fixincontinence.com. This is a great resource from one of our partners, Boston Scientific Corporation, who's the one who makes that artificial sphincter. They've got great information for patients and their loved ones on that website for what you can expect leading up to the surgery and even months and years afterwards. You can also hear from patients who have had the surgery done. And if you're interested in talking to a patient directly, please do talk to me or talk to your urologist to see if that might be an option for you. So that's going to be it for incontinence. We're going to move on now from that to talking about restoring your sexual health. How do you get that intimacy back into your life after undergoing treatment for prostate cancer? So let's talk about erectile dysfunction. So to have erections, you need to have a lot of systems in place, right? There has to be some signal for your brain that says, hey, it's time for us to get going. It's time to get intimate. I'm in a situation where I want to have an erection. That signal goes up to your brain. your brain sends another signal right back down to the blood vessels in your pelvis. The penis fills up with blood, and a mechanism enacts that keeps that blood locked into the penis in order for you to have that nice, firm, strong erection while you're being intimate. And as soon as you achieve orgasm, that blood leaves the penis and the erection is over. Now, any disruption to this pathway, whether it be the blood supply, the nerves, anything like that, can affect the strength of your erections. And some men find that whether they have surgery for prostate cancer or radiation, there are some men who never regain the ability to have a full erection on their own. So what does that look like? Well, you can see some recovery for as much as 2 years following that initial treatment. But at that point, really what you have is what you have at that point. You're going to be talking to your urologist, you're going to be talking to your loved ones. And if you're not getting back to where you need to be, well, we need to talk about some options if this is something that's important to you. There is some data that doing things like penile rehabilitation following prostate surgery can help those nerves to regrow after the surgery. Nerves go incredibly slowly, on the order of 1 millimeter or 2 a month. And there's some evidence that using things like Cialis or other pills or vacuum devices, all of those things can encourage blood flow into the penis and may help you get those erections back early. But again, if those erections are not getting back where you want them to be, certainly by 1 year or 2 years after treatment, you need to talk to your urologist about what options might be out there for you. So let's talk about the options in general, right? The first thing is the thing that you've heard the most of, pills. Things like Viagra, Cialis. These are called PDE5 inhibitors, and the name is not the most important thing, but what is important is what they do, and they help pull blood into the penis in order to help you get that erection. If this is something that you're interested in, your urologist will look at your other medications and your other health conditions and see if this is a good option for you. The important things to remember here is that the pills don't work by themselves. Okay, you have to still have some sort of stimulation, whether that's with a partner or by yourself, in order to work together with the medication to encourage that nice, strong erection. If you're not interested in pills, or maybe your urologist has said that they're not a good option for you, vacuum pumps can be used very well in this space. You'll see them here on the top right of the screen. This works exactly the way you think it does. It pulls blood into the penis. Now, it works in conjunction with a constriction band. So as you can see in that picture, there's a little red band there at the base of the penis. So the vacuum pump pulls the blood into the penis, and the constriction band keeps it there during intercourse. Again, when you remove the constriction band, the blood is able to drain out. For people who aren't interested in that option, or maybe want to try something else, a really good option for our patients are penile injections. Now, I know that this sounds a little scary when you think about sticking a needle into what is really a really delicate and sensitive part of your body, but I see a lot of men who are very happy with this option. This is a strong medication that's injected directly into the base or side of the penis when you're ready to have intercourse. It takes about 15 to 20 minutes to work, and as many as 80 to 85% of men can get very strong erections that are more than adequate for penetration with this medication. Again, this is not an option for everyone. And certainly if you're someone who doesn't like needles, maybe this isn't the best option for you, but certainly something to think about. They do make pills called suppositories that go in the urethra. You can see that on the bottom right. These, to be honest, we don't use a whole lot anymore. We used them a lot more about 10 to 15 years ago, but they can cause a lot of irritation inside the penis. And I find that patients tend to prefer one of the other options, so I won't talk a whole lot about that. And last but not least is the option of a penile implant. Now, this is an internal penis pump that is completely underneath the skin and concealed, and no one can tell that you have it from the outside, but is a really good option in order to give you a nice, strong erection when you're looking to have one. So let's talk about that penile prosthesis a little bit more. These come in different forms. There's malleable penile prosthesis, there's an inflatable penile prosthesis, and certainly if you go look online or talk to your urologist, we can give you a little bit more information on those options. What you see pictured here is the inflatable penile prosthesis. This is the most common device that is placed here in the United States. The really nice thing about this design is that the cylinders that go in the penis are inflatable. Importantly, that means that you can deflate them. So when you're not having an erection, you're not ready to be intimate, those cylinders can be nice and empty. It gives a much more natural appearance and feel to the penis. It's more comfortable for you going about your daily life when you're not involved in intimate activities. And when you're ready to have that erection, you're able to reach down into the scrotum, pump the pump that's down there. Again, it's underneath the skin. No one can see it, but you'll be able to feel it. And that'll fill those cylinders up with saline or salt water and give you that nice, strong erection that you're looking for. Now, there are a lot of benefits to this option. What are those? So one, it gives you a little bit more spontaneity. So unlike the pill where you're taking the pill and you're waiting an hour or 2 hours to see if it's going to work and when it's going to work, or the injections where you're taking the injection and you're getting a response in 15 to 20 minutes, here, that erection is right there at the tip of your fingers. You know, if you reach down and you squeeze that pump on the device, you're going to get the erection that you want every time right away. And a lot of men and their partners are really grateful to be able to get a little bit of that spontaneity back in their lives. As we said, it's completely concealed. It's underneath the skin, and especially with the inflatable model, when you are not having an erection, the penis is able to be tucked away nicely in your pants like normal, and no one walking down the street is going to know that you have anything different on the inside. The other nice thing is that you're going to be able to maintain that erection until you're ready for it to go down. There's actually a deflate button on the pump itself in the scrotum. And until you press that button, that erection is going to be loud and proud and in charge. It's going to be there for you to use. But when you're ready to be done with it, you press that deflate button, you squeeze the fluid out of the cylinders, and then you can go back to life as normal. No more waiting around with an erection from pills or injections that's lasting a whole lot longer than you want it to. You're able to move on with your life. So, just like the incontinence, this is something where it's really important to track your progress. You want to keep an eye out, talk to your loved one, maybe keep a journal after your surgery of what erections are looking like for you. Do you wake up with an erection in the middle of the night or in the morning? If you're taking Viagra, do you feel any different? Do you see any increased blood flow in the penis? Even if it's not an erection that's firm enough for penetration, is anything happening? And again, talk to your urologist, really be open with them. Take the time to sit down and talk about the ins and outs of what's going on here so that you can make the best decision for you about where you fall on this spectrum. And it's not a linear path. You know, some people will go pills, vacuum device, injections, and then perhaps move on to the penile prosthesis. But it doesn't have to be that way for everyone. You know, if you are not interested in injections, you're not interested in a vacuum device, you're ready to get that spontaneity back in your life, you can certainly think about a penile prosthesis earlier if that's something that you're interested in. And if it's something that you're ready to delay, well, then we wait. We wait until the time is right for you and your loved one to get right back into the game. Again, it's important. Assess your condition, see how things are going. What does your partner think? What does your partner want? Do you have a partner? All of these things are going to be important as you weigh the risks and benefits of these procedures and decide what's going to be best for you. Again, there's a great website for this. This one's edcure.org. You can see that website there. Again, this has information on all sorts of different treatments for erectile dysfunction and has information for both patients and their partners about what these entail. You can hear testimonials from patients and their partners who have had penile prostheses done, what their journey was like, and maybe see if this is something that would be right for you. So I'm sure you're going to have a lot of questions. And again, at the end of the day, having a personal conversation with your urologist is going to be the best way to answer those. But there are some frequently asked questions that I can handle for you here. The first is, well, how long does it take to achieve bladder control after your prostate surgery? Again, that stress incontinence, SUI, is usually resolved within the year following a prostatectomy. But in some cases, usually 10 to 15% of cases, that leakage can last longer. If that is the case for you, talk to your urologist, assess how much leakage you have and whether it might be time to consider something a little bit more. The next question is, well, why don't all men recover erectile function after treatment? Well, let's talk just about having your prostate taken out, the surgical approach to prostate cancer. The nerves that give you erections lay right on top of the prostate. They're draped over the top, kind of like a blanket. And during your surgery, your surgeon may need to actually take those nerves in order to get you cancer free. And even in cases where the nerves are left entirely intact, the swelling, the bruising, the stretching from the surgery itself can cause long-term or, in some cases, permanent nerve damage. The other thing to think about is, well, prostate cancer is more common in older men, and older men are more likely to have problems with high blood pressure, heart issue, diabetes, other comorbidities like cigarette smoking, or just not being as active as you used to be. And all of those things can affect the health of the blood supply and the nerves in the pelvis that give the penis the ability to have that nice, strong erection. So your question is, why don't all men recover erectile function after treatment? Well, let's start just with the prostate cancer surgery, right? So the nerves that give you erections lay on the top of the prostate, kind of like a blanket. Okay. And the goal is always to remove the prostate and leave those nerves intact. But that's not always possible. Your surgeon's primary goal when you have your prostate taken out is to cure you of your prostate cancer, to get absolutely every bit of that prostate cancer out. And sometimes that requires taking the nerves on one side or even on both. And even when the nerves are left in place, the stretching, the bruising, the just damage that happens to the nerves getting them off of the prostate can cause long-term or in some cases even permanent damage to those nerves or to the blood supply that goes to the penis and gives you those erections. The other thing to think about is that, well, prostate cancer is more common in older gentlemen. And older men are more likely to have other issues, things like high blood pressure, things like heart disease, things like diabetes, or other comorbidities like cigarette smoking or just even not being as active as you used to be. And all of those things affect the strength of the blood supply and the health of the blood supply and the nerves that are down in the pelvis. And those are the things that are important for you to have an erection. And so all of these things contribute to the overall picture. There's some men who have these conditions who have nice, strong erections after prostate surgery, no problem. And there's some men who just have long-term issues. This is, again, where it's important to keep an eye on how things are going and have that discussion with your family, your loved ones, and your urologist to figure out when it might be time for you to consider doing a little bit more for erectile dysfunction. The last question is, well, those penile implants we talked about, who pays for that, right? Are they covered by insurance? Are they covered by you? The answer is it's a little nuanced. Most insurers cover the diagnosis of erectile dysfunction and stress incontinence. The reality is it depends a little bit on your insurance carrier and what plan your employer has opted into. The bottom line is Medicare is actually really, really good at covering these procedures, especially the penile implant. So if you are 65 or almost 65 or thinking about getting on Medicare and worried about getting coverage for this, I tell men all the time, wait till you're 65. If there's a problem with paying, get on Medicare and Medicare will cover this for you. But you should be having this discussion with your insurance provider, with your surgeon to see what this is really going to look like for you. So at the end of the day, who do you want to hear from? You want to hear from your provider, you want to hear from your family, and you want to hear from people who have been through this. Again, these websites that we've been to, fixincontinence.com and edcure.org, are both full of great information from patients and their loved ones who have been through treatment for these conditions. You see some testimonials here here's a gentleman who's had the sling done. He says, he's not even using pads anymore. And every once in a while, he puts on a jacket he hasn't worn in a year or two and finds an old pad and says, oh gosh, I'm so glad I'm through that. And below, you've got a man who had both an artificial sphincter and a penile implant. That's an important point. Some men get both of these procedures or get a sling and an implant, either at the same time or during different procedures, depending on their clinical picture. And the possibility of getting both of these conditions treated has a possibility to really give you that quality of life back, give you the confidence to go about your life, not worrying about leaking when you're in public, being able to go on trips without having to bring suitcases full of incontinence pads and diapers, and knowing that you're going to have the confidence to do the things that you really want to do. Here are those resources we talked about earlier: fixincontinence.com, edcure.org. These other websites below are also great resources for you. The American Cancer Society has great information on prostate cancer treatment, the course and other resources on there. The Prostate Health Education Network, Us Too, which is a prostate education support network. And then the whole reason you're here, zerocancer.org, hoping to end prostate cancer. All of these websites are great for you to go on them with your loved ones, send them to your family members, really learn more about the options that are there for you. It's important to remember that there are treatment options for every man. Everything from non-invasive treatments to pills to minimally invasive surgeries to more invasive surgeries with one of these devices. But you're never going to know if you don't read more about it. You don't talk to your provider about those options. If you want to talk to me, look me up. I'm happy to see you anytime. I'm happy to answer your questions and see if one of these might be a good option for you. Otherwise, look for your provider, talk to your oncologist, see who they recommend. You want to find someone who you trust to take care of you for these issues. I hope this helps. I hope this gives you a little bit more information as you're going through this. I know no one wants to be dealing with these issues. No one wants to be worried about leakage. No one wants to be worried about their erectile function and being able to get the intimacy back in their lives. But that's what we're here for. We're here to talk about these things with you. We're here to have the difficult conversations. Remember, as much as it's a difficult conversation for you, it's a conversation that we have every day. And we're happy to have it with you. We're happy to answer questions and see how we can make life a little bit better for you.